Hello, everyone. My name is Linda Sarna, and I have the honor and privilege to be the 7th Dean of the UCLA School of Nursing, a school that's just celebrated its 70th anniversary. But today, my honor is to introduce one of our outstanding faculty members, Lecturer Barbara Demman. Barbara has had extensive clinical experience that she has integrated into her teaching. She is much beloved by our students, and in 2014 was selected to receive a Daisy Award because of her teaching in our pre-licensure program. She also was selected by our students in 2019 to be the first nurse to deliver a last lecture award because of her extensive experience and commitment to palliative care. One of Barbara's sidelines actually has been mindfulness. She's used this to decrease stress and compassion fatigue among nurses and nursing students in the past. And this year, she used it to help us all adjust to the stress and strains of the pandemic. She held special events for both students, faculty, and nurses so that we could, again, deal with this very challenging time of COVID-19. And I know that you're going to enjoy her lecture today. Thank you, everyone.
Hi there, my name is Barbara Demman, and this is an introduction to mindfulness and stress reduction. First, I just want to say welcome to the Bruin family, all the UCLA students and UCLA family. And I am an alum myself, and I feel such a strong kinship to being part of the Bruin family and just really blessed. So I welcome you all, and it's a pleasure to be speaking with you today. A little bit about me. I am a registered nurse. I'm also an acute care nurse practitioner and a clinical nurse specialist. As I mentioned, I'm a UCLA alum from 2008. I received my master's here. I've also been a lecturer at the School of Nursing since 2009, and for a few years in between, I was also the program director. I currently have a clinical practice in hospice and palliative care. And one of my passions is wellness and mindfulness, not only for everyone, but especially nurses and nursing students. So I was able to complete a fellowship at the UCLA Mindfulness Awareness Research Center, which is a branch of the medical school in the psychoneuroimmunology area. And I currently do research in mindfulness and resiliency within nurses, and especially during the COVID-19 pandemic. And my personal story is I had my baby girl here at UCLA Medical Center, and that's her up on the side of the screen in an incubator. She was born prematurely and early, and we had the most incredible care in the NICU. And a great story is that over the course of her being there, we had 11 nurses who were students of mine from the past take care of her. And it was just such a miracle and so beautiful and such a Bruin family feel. And here she is on the upper right-hand corner. Her name is Rocky, and happy to say that she's just thriving and doing really well, thanks to the great care we received at UCLA Medical Center. So today I'm going to talk about mindfulness and stress reduction. And I first just want to start with a quote from John Wooden, one of the UCLA basketball coaches who led UCLA to many championships. And he said, "No written word, no spoken plea can teach our youth what they should be, nor all the books on the shelves. It's what the teachers are themselves." And I really feel that we can train our students to be excellent in their careers, and we can train them to be stellar in performance and, educate them, be mentors. But at the same time, are we really training our students for the stressors of their job? So for me, we can mold someone to be an excellent nurse, but are we also teaching them how to handle the stress of being a nurse and what comes with that occupation? So personally, I feel it's very important to lead by example as an educator and mentor on what a work-life balance is. And this is why I have a passion for mindfulness and stress reduction. So, on this journey, let's talk together about what is mindfulness, what are the benefits of a mindfulness practice, how could mindfulness influence stress reduction and self care, and also resources for mindfulness if you're interested for the UCLA community. So, what is mindfulness? Well, sometimes a nice way to define something is to first define what it is not. So, I want to talk about something called mindlessness. And this is very much being on autopilot, not very focused, sometimes just in a reactive mode. Many times in our waking hours, we are in thinking about mode. We're not very present and aware, and we don't really have an attention to what is currently happening. Some great examples of mindlessness is has anyone ever parked their car and then went into wherever they are and then couldn't find their keys? And you know your keys are on your body somewhere, but you just can't find them. Or has anybody ever, driven home from work or wherever and then not really remembering driving home? Or perhaps eaten a meal and we were on our phone while eating and not really remembering how the food was or how it tasted. So these are just some examples of mindlessness, kind of being on autopilot, not being really present in the moment with what's happening. So autopilot's kind of like living in this reactivity. Some say it's being chauffeured around by the brain. The brain thinks something and we just follow it, and we just are impulsively following the stimuli from our brain, not really consciously choosing what we're thinking about, and also not really aware of our surroundings and events. And I have a picture here of a gentleman on the phone, and he's so distracted that he's about to fall down this deep hole. And this picture is actually really personal for me because one time I was on my phone coming out from work at the hospital, and I stepped off a curb and I didn't even see the curb, and I misstepped and fell. And I'm so fortunate that I didn't get injured, but it was a great wake up call that I was not very present with where I was in my environment. So there was a great research study out of Harvard, and basically they had a large sample population because they offered everybody a phone. And what they would do throughout the day is a ping would come up on the phone, and they would ask people, at this moment, are you thinking about the future? Are you planning? Or are you thinking about the past and ruminating? Or are you in the present moment? And then a follow-up question would happen, which was, are you happy? Or how is your well-being or your mind state at this time? And the research found that about 40% of the time, people are thinking about the past, and about 50% of the time, people are thinking about the future, and about 10% of the time, people are in the present moment and being present with where they are. And what was interesting is with the follow-up question, it showed that people reported more fulfillment and more happiness when they were in the present state, even if it was something not very happy. Like, let's say they were with someone who was really suffering or having a hard time. Still, when someone reported being present, they had a more fulfillment score, a happier score. And what this study kind of told us is that mind wandering, thinking about the future and the past, can be a predictor for a lack of happiness. So, how often our minds kind of leave the present tends to be more of a predictor of our happiness than actually the activity we are engaged in. I know for me personally, I have been at beautiful environments or wonderful social parties, but if my mind was thinking about something unpleasant, no matter what my environment was, I still had a feeling of sadness or unpleasantness. So, whereas if I kind of switched my mind to the environment and seeing where I was, I had more apt or chance to feeling fulfillment. So it's a very interesting study, kind of deducing, theorizing that a wandering mind is somewhat of an unhappy mind. So examples in patient care is we have women in labor. So many times some women, the way it works with labor is the uterus will contract and that elicits a pain response, very painful. And then the uterus will stop contracting and there's a chance for a relief of pain. And sometimes with some women is even when there's the first contraction of the uterus, there is a pain response that just happens and continues. And the woman is in pain no matter what. And even when the uterus is not contracting and we say, ma'am, just so you know, we see by the monitor the uterus is not having a contraction, the woman is still experiencing pain. And indeed, that pain is very real. So that's kind of an example sometimes of not, once there's a stimulus, sometimes it's hard to come back to the present moment. Another example is pediatric laceration repair. So what happens if some of you are familiar with going to the dentist or ever having a laceration repair is there's some anesthesia given to numb up the area. And that's quite painful. It's a sting and it's uncomfortable. But the reason for that is so later it's not as painful. And many times with pediatric cases, once that, a small needle of lidocaine is given, it just cascades into a pain response. And the children, after everything that happens with that, they are just in pain and screaming. And even when it's numb, it's just still a stress response. So that's another example just within patient care. And just on a total side note, this doesn't have to really do with the presentation, but I have the cutest story. One time I was doing a laceration repair on a 6-year-old boy, and he was just so cute and so brave. And he, I told him in the beginning, we're just going to numb you up and it won't hurt afterwards. And he really listened and really responded. And as I was doing the suture repair, he said, you know what, you're right, it doesn't hurt anymore. And I was just like, oh gosh, this little boy is so sweet. And later on, I told him, okay, we're all done. Now I just need to go get a dressing. And he looked at me totally seriously and he said, okay, but I don't like ranch. So, it's just kind of being aware of how we speak with our children in the concrete language, because he really thought the dressing was ranch dressing and not like gauze and tape. Okay, so there's a great definition of mindfulness by Dr. John Kabat-Zinn. And he started doing research in the early 1980s and has been continuing doing research, especially among people with chronic pain. And his definition of mindfulness is so on point that I thought we could have a YouTube video showing that. And he defines it as purposely paying attention in the present moment in a very particular way, non-judgmentally, kind of a form of attention training.
My working definition of mindfulness is that it's the awareness that arises through paying attention on purpose in the present moment and non-judgmentally. So it's awareness, and the awareness is cultivated by paying attention. And in a particular way, on purpose, in other words, intentionally, in the present moment, which is the only moment we ever have to be alive in. And then, most challenging of all, non-judgmentally. And that means, of course, we have judgments about everything, but to not be caught in those judgments so that we color everything through our likes and dislikes. So that sounds pretty simple. Okay, paying attention, I can do that. But actually, when you start to pay attention to how much we pay attention, a lot of the time our minds are all over the place and we have a very hard time sustaining attention. And our attention is not very vivid and it's not very stable. And teachers go out of their minds screaming and yelling at their classes of students, pay attention, pay attention, pay attention. But nobody learns to pay attention by being screamed at to pay attention. So, but it's something that we can teach to people how to pay attention. And it's very, very powerful to learn how to sustain attention moment by moment by moment by moment by moment.
So just taking that definition to this drawing, which I really love, is that here we have a person walking in the park and the dog. And if we look over on the left at the bubble of what the person is thinking about, we see that it is all the things that we think about in our mind, like the errands we have to run, the laundry we have to do, the people we need to call back, the emails to send, the mail, the bills, whatever it may be. But when we look at the dog and then look at the bubbles of what the dog is thinking, we see that what? The dog is very present. The dog is looking at the park and how beautiful it is and looking at the sun. And really, as the words say at the bottom, is the mind full of many things, or are we being mindful and present, which is what many pets do and children. And it's a reason why it's just so fulfilling to be around pets and children, is that they are very much in the present moment. And that present momentness is so cherished and fulfilling. And it's very enjoyable to be with pets and children. So mindfulness is not about relaxing or clearing the mind. It's not about controlling the thoughts. It's not necessarily a quick fix. And sometimes it's not really easy or enjoyable in the beginning. Mindfulness is this training stability, awareness to understand what's happening in the thoughts, the emotions, and in the body or felt sensations. And it's also a shifting of our response to the pleasant, unpleasant, and neutral experiences. Ideally with an approach of allowance or allowing and the application of kindness to ourselves. So mindfulness is something we all possess. It's not a secret power or something magic. It's within all of us. And it's more readily available when we practice it on a daily basis, as with anything. If we want to be an excellent basketball player, if we practice daily, we're more apt to, be skilled at that. So same thing with practicing mindfulness. So it can be cultivated and trained. And there's kind of two different paths of training. There's a formal practice, which is, sitting down, really focusing, what some people call a meditation position, noticing when the thought gets distracted, having an object of focus. And the breath is actually a very common object of focus. One, because everybody has the breath, and that's something in common we all have. And also many people find the breath to be very calming. Not all, but many. An informal practice would be, the same quality of attention and attending to that object. However, it would be everyday experiences such as eating, walking, or brushing teeth. Some of the practices of mindful eating are really incredible, and suddenly food becomes such a pleasurable experience. Or walking. I know in between seeing patients, I used to think, okay, if I can make a list of all the things I have to do in between seeing patients, I'll achieve more. But when I started to apply mindful walking in between the rooms of seeing patients, I actually had more calmness within me, and I actually had a higher productive outcome. So one other informal practice is called STOP. It's an acronym. And on the next slide, I thought we could do this practice together. So if you'd like to join in, whatever you're doing right now, if you could just stop. So if you're holding your phone or if you were looking somewhere else, if you could just stop that. And now take a nice deep breath, really inhaling all the way down to your lungs and exhaling, and take as long as you need to. And then just observing any tension in the body and letting that relax. And then opening your eyes if they were closed and proceeding. So that's a great example of just a very informal, mindful practice. And it took us, I think, about 5 to 10 seconds, because many people say they don't have time to add stress reduction or mindfulness to their life, but there's ways to do it so it's not so time consuming. In addition, in a study I did, we educated emergency room nurses on this practice. And they would implement stop before answering the phone or stop when they were feeling triggered. And ultimately, they started becoming colleagues and holding each other accountable. If they saw one of their colleague having a high stress experience, they would go up and say, stop. Stop, take a nice deep breath, observe, and proceed. So, just an example of an informal practice. So mindfulness training as a clinical intervention, basically the question of research is, what is it? What is mindfulness? How is it beneficial? And what does the research show? Excuse me. Okay, so in the research world, we say that they are mindfulness-based interventions, or MBIs. And these are interventions using mindfulness to alleviate whatever the problem is in a targeted population. So would a mindfulness-based intervention decrease exacerbations in people with multiple sclerosis? I know some of you are having children go off to college, or children attending college during a pandemic. So we could do our own new MBI research by saying, would a mindfulness-based intervention decrease perceived stress and anxiety in parents who are sending children off to college during the pandemic, or something like that? That's what the MBIs are. And there's many MBIs, or mindfulness-based interventions, out there. I'm not going to go into these, but perhaps you may have heard of them, or in the future you may hear of them. But there's mindfulness-based cognitive therapy, which is extremely effective for relapse depression. Mindfulness-based stress reduction, which has shown a lot of data for chronic pain. There's Mindful Schools program, which is really big in implementing mindfulness within the elementary school system. And Inward Bound, which has some research for teenagers doing outdoor nature backpacking and implementing mindfulness. Mindful parenting, mindful-based eating awareness training, relapse prevention, dementia care, mindfulness self-compassion, dialectical behavior therapy for borderline personalities. So there is a lot of interventions through research that has shown to be quite effective with mindfulness-based interventions. And here's just a nice little graph. As you see on the bottom X line, these are the years starting from 1980 on the left to the present time. And then the vertical line, or the Y line, is the number of articles. And if you start on the where it says 1980 in the corner of the graph, and you see that this is actually documenting how many mindfulness journal articles and research articles that have been published. So in the 1980, you see that there's none. And then as you go through the 80s and the 90s, in the late 1998, around there, we start to see some journal articles implementing mindfulness-based interventions. And then if you see over the years, it goes up and up and up and up. And every year we are seeing this increase of research implementing mindfulness. So what this shows is a couple of things. One thing is it's showing that there's funding, because often there's not research if there's not funding. And, one thinks, well, why is there more funding now? And it's because the previous research is showing effectiveness. So it's very exciting to see kind of this new journey of mindfulness-based interventions within the research world. So mindfulness-based interventions, or mindfulness-based stress reduction, effectiveness and benefits, the impact has consistently demonstrated in research that there is a reduction of perceived stress and anxiety. Relapse depression is a big one. So the mindfulness-based interventions has not shown the initial prevention of depression, but it has shown that after someone has episodes of depression, by implementing mindfulness along with other perhaps pharmacological interventions, there is a decrease of relapse depression, which is pretty significant. It's also shown a lot of promotion of self-care, not only in patients, but in healthcare providers, an increase of mental well-being scores, therapeutic relationships, a decrease in burnout symptoms. And then besides psychosocial effects, there's also been a lot of physiological effects within the brain, which has been really exciting. And due to our new diagnostic tools of like functional MRIs, we're able to see these results of neuroplasticity, neurogenesis, changes in the amygdala, which is kind of the part of the brain that works with fight or flight. immune response, even changes of natural killer cells in those who implement mindfulness or not, and pain perception. So it's just very exciting. And there's lots on the internet. I'm not going to focus a lot on this, but if anybody has interest in there, there's lots of resources. Another thing I just want to talk about that mindfulness is very good for is burnout. And this is occurring in many occupations, especially during the pandemic. There are many parents who are home that are working full time and at the same time teaching their children. And just not to mention even pre-pandemic, there was, or there is just so much to be done through work, and we're very overscheduled and very booked and very busy people. So what is burnout? It's basically emotional exhaustion, depersonalization, and a diminished personal accomplishment. So within nursing, it's very easy to feel emotionally exhausted. Sometimes there's a diminished personal accomplishment, such as I've been working all day and I haven't had time to, talk to my patients the way I want to, or chart effectively, or do everything. So sometimes it's hard to feel fulfilled or like a sense of personal accomplishment. And also within burnout, we can start to get a depersonalization or a removal of oneself with empathy. So I know for healthcare providers, but I think this goes for many people in many occupations, when there is actual true burnout from stress or lack of personal accomplishment or emotional exhaustion or the other things, we get high rates of job dissatisfaction, which increases employee absenteeism, which declines empathy and professionalism. Within healthcare providers, it turns into poor patient care and satisfaction rates. Statistically, there's actually been an increase in medical errors in providers who are burnt out. And there's also elevated rates of substance abuse. Not to mention too, with employee absenteeism or turnover, it's very expensive to hire and train a new employee. In the nursing world, the cost of nursing turnover just for one nurse is about $40,000 to $60,000 just to train a new nurse. So burnout is a problem. It is a problem. And when we have these cycles, so let's say at the top here in this cycle, we see that there's job dissatisfaction, and that can lead to burnout. And then that leads to employee turnover, which leads to employee shortage, which leads to inadequate staffing, which leads to more job dissatisfaction. And we see that this cycle can be very, it just keeps going and going and going. Now, the nice thing about all cycles is it can be broken anywhere. So we can kind of intervene somewhere. So where can we intervene here? What can we do to prevent burnout within ourselves? Or how, as we educators or mentors or parents or family members, how can we prevent burnout within ourselves and those that we love? And this is a cartoon here that you see these people working on their unit and they're looking down, and the gentleman says, "Frank just up and exploded. I hope I never get that burnt out." So what we really need to think is to ourselves is, how do we move from just hoping we don't get burnt out to actively preventing ourselves to getting burnt out? So this is one possible solution, is these mindfulness-based interventions, or implementing mindfulness within our lives. And when there's been studies for mindfulness-based interventions and burnout prevention, it's been quite positive in outcomes. It demonstrates a decrease in stress, negative affects, anxiety, ruminating thoughts, and burnout, and also an increase in positive affects, life satisfaction, empathy, consumer optimism, and self-compassion. So mindfulness is something that, it's starting to become a ubiquitous word within our society and starting to be implemented in different areas. We see here that mindful schools, many schools are starting to implement mindfulness. I even read a great study where they switched up detention with implementing mindfulness, and students needed to meditate instead of, just sit in detention, and the powerful impacts of that. The military is implementing mindfulness, and the VA system has a huge mindfulness implementation program, especially for PTSD, and there's a lot of positive outcomes with that. The prison system, there's been some incredible impacts with implementing mindfulness mindfulness there. And then even within politics, there's one congressman who has written a book about how mindfulness, can help save our country. So we wish him well on that endeavor. Just mindfulness is becoming a little bit more present in society. And one thing I love is within the mindful school programs, because a lot of people were wondering, could small children really practice mindfulness? Could small children really meditate? And it's been incredible. And there's some great videos out there on the internet too about children with their mindfulness. And one of the tools they do are these things called glitter jars. And the children put glitter all in a jar and seal it real tight. And then whenever they feel agitated, or part of the lesson is when I feel angry, or if I feel flustered, or if I feel tight in my body, this jar, I shake it up and I see that this is how my mind is. And if I just keep taking a couple deep breaths and calm my body and relax the tension in my face and breathe, I see that the glitter falls down and settles, and then I can see through the clear water. And that's what just a mindfulness practice can do. It can help us settle ourselves when we're feeling very frenetic or flustered. So it's quite beautiful. I really love these glitter jars. I think they work well with adults too. So resources for the Bruin community, if there's interest, if you have interest for yourself, or often when I do these things, people will come up afterwards and say, I want my husband to do mindfulness, or I want my child to do mindfulness. But hopefully too, we can think of on ourselves how we can implement mindfulness and decrease stress. But we are very lucky at UCLA. We have the UCLA Mindfulness Awareness Research Center. And as I mentioned previously, this is part of the medical school. And they offer many courses. They offer 6-week-long courses. They also have kind of day-long retreats, and they have drop-ins daily on the campus. So their website is here, or even if you Google UCLA MARC, or Mindfulness Awareness Research Center, you'll find that. Now, during the time of COVID, a lot of things are online, but they are still offering courses and drop-ins and day-longs. So I would definitely check out UCLA MARC Center. Also, they have a beautiful app. It's a pretty easy to use app, but there are many wonderful mindfulness apps out there. Some more common ones are Headspace or other things. And at the bottom of this page, there's also a link to a free online course, because most of these courses do cost something. But if one is interested in doing a self-study, there's actually a free online course here. So that could be something too. So besides the MARC Center and besides this free online course, there's also, University of Massachusetts and Mass General that really pioneered this mindfulness research about 30 years ago. And if anyone is in the LA area, Los Angeles is so wonderful for resources. And so there's a great area called Insight LA that just has so many different type of courses and different specifics too, mindfulness-based stress reduction for, people working in the law, or lawyers, or for healthcare providers, or parents, or teens, or, so there's a lot of different specialties too. So I just want to say thank you very much. It was a pleasure to speak with you, especially about something that I feel so passionate about. And welcome to the Bruin family, as I said, and I'm just honored to be part of it, honored to speak with you. And if any of you have any questions, there is my email below. You also can Google, UCLA School of Nursing and my name, and my bio and links to how to reach me will come up too. So thank you and have a wonderful day.